Hello and welcome to News Across Nigeria. I'm Ayotunde Balogun. Coming up on the program, British Foreign Secretary Boris Johnson visits Nigeria, pays tributes to war heroes. Resident doctors and federal government hold talks to address lingering issues of health unions. And Cross River State government signs Homeland Security Bill into law. The British Foreign Secretary Boris Johnson has paid tribute to Nigerians who lost their lives during the First and Second World Wars, as well as other peacekeeping missions around the world. He made the comments during a visit to the Commonwealth War Graves in Abuja, where he also praised Nigeria's role in peacekeeping efforts across Africa and beyond. Mr. Johnson was accompanied to the site by Nigeria's Foreign Affairs Minister, Mr. Geoffrey Onyema, who asked for a constant reflection on the devastating effects of war. Some security chiefs were part of the trip to the war graves.
The importance of memorials cannot be overemphasized, as they represent historical symbols that link the past to the present and enable people to remember and respect the sacrifice of those who died, those who fought, who participated, or were in any way afflicted by conflict. They also serve to remind us of the devastating effects of conflict, which so tragically wreaks so much death, destruction, and suffering, and reinforces the imperative for peaceful settlement of disputes.
I have no doubt that the friendship between Britain and Nigeria, strengthened by our shared sacrifice in the cause of liberty, will only become closer in the years ahead. And I am proud to see that spirit of sacrifice in the cause of liberty memorialized here today. One of those courageous soldiers was also the father of General Buratai, who unfortunately cannot be with us today. But he, like other Nigerians, fought with the Chindis in daring operations behind enemy lines. And tragically, of course, many Nigerian families were bereaved when their sons did not come home. And today we pay tribute to their memory. We reflect with humility on the profound debt that we owe. We recall the immense contribution in our own time of the armed forces of Nigeria to peacekeeping operations around the world, despite all the security threats here at home.
Representatives of the European Union are in Bayelsa State to monitor the progress of the Niger Delta support program, which has been implemented by the Bayelsa State government. During a courtesy visit to Bayelsa State, a representative of the union, Kurt Cornelis, gave an assurance that the next phase of development will soon begin. This includes portable drinking water for the people of the state. The Deputy Governor, Mr. John Jonah, believes the collaboration with the European Union will be beneficial not just to the people of Bayelsa, but the entire Niger Delta.
Once again, thank you very much. These are things that we can do once we install. The effort required in sustaining it is not as much as when they get generators and the rest. I just felt I should make that just as one example, but there are others also. So once again, you're welcome to Niger Delta. You're welcome to Bayelsa State, and we have called it the glory of all lands. It's the glory of all lands. Very, very proud of that. And any person that comes to us, we always tell the person, this is what we are. We're very peace-loving people. See it for yourself. I don't know whether you are going to take them to some riverine areas where they enter some boats We like people driving in our boats.
Bayelsa is, of course, in the core of the Niger Delta, so it's one of our most important partners. And I've just arrived this morning, but I can already tell you from what I hear from my team and also the government officials, Bayelsa State officials, that good progress has been made in many aspects, and now we are going to the next phase, which will be works, implementing the works infrastructure in a number of communities in 2 selected LGAs.
The leadership of the Nigerian Medical Association and National Association of Resident Doctors have been meeting with the federal government over the poor state of facilities and hospitals across the country and payment of salaries. They were invited for a closed-door meeting to thrash out the issues raised by both associations to avert a strike action called for Monday next week. The Minister of Labour, Dr. Chris Ngige, and his colleague from the Ministry of Health, Dr. Isaac Adewale, have assured the doctors that their demands will be looked into. The NARD team is led by its president, Dr. Onyebweze Gochukwu, and the NMA team is represented by Professor Mike Ogirima. Meanwhile, the Edo State chapter of the Nigerian Medical Association has asked the state government to declare a state of emergency in the entire healthcare delivery system in the state. Addressing the media at its secretariat in Benin City, the state capital, on Wednesday, the association wants attention to be paid to the state of the healthcare sector. Some of the areas the doctors have asked the government to intervene include, but not limited to, infrastructure, recruitment of manpower, as well as the welfare of medical personnel.
Even though there seems to have been a relative industrial harmony in the public health sector in Edo State for a few years now, this situation, however, should not be misconstrued to mean all is well with the sector. This is according to the Edo State branch of the Nigerian Medical Association, NMA, who have called this press conference to make some categorical statements on the need for the government to overhaul and reposition healthcare delivery in the state.
The health sector today is suffering a great lack of facility and manpower. The central hospital, which used to be called specialist hospital, have since become a shadow of itself. Patients have to seek help in peripheral facilities and most times fall into the hands of quacks. This untold hardship is most undeserving of the good people of Edo State.
The doctors commend the state government for recently indicating interest in the primary healthcare component of the sector and urge it to go beyond that stage.
There is almost no provision of primary and tertiary health services in the state. The women still deliver in their homes in their numbers, and complicated pregnancy is almost a death sentence in the rural area. This is because the needed attention at the primary health care level is not given in terms of funding and manpower development. Tertiary health care services is almost non-existent.
They also draw attention to the urgent need for the government to address the manpower shortage to cater for the ever-increasing healthcare demands in the state.
There are less than 130 doctors in Edo State Hospital Management Board, serving over 3 million people residing in Edo State. This number includes the specialists, medical officers, housemen, and there are roughly 35 specialists in the entire state, serving 18 local government areas. This number is a far cry from what is needed in the state.
The doctors end the meeting with the hope that government will take urgent steps to pay due attention to the issues raised.
Well, after the break, we'll be taking a look at the issues of the Nigerian medical doctors. After this, please stay with us.
From its leaders to its legends, the people, their pain, their joy, and their challenges.
Africa has massive resources for both conventional and renewable energy.
We need to invest more to remind the leaders of their role in managing diversity in the most constructive manner.
Network Africa connects the continent every weekday at this time.